Bill Gates is the co-chair of the Bill and Melinda Gates Foundation. The Microsoft co-founder is one of the world's most well-known and most respected philanthropists. His organization's programs work across the globe in several key areas, including health, education, economic development, and gender equality.
I'm Andy Serwer, editor-in-chief of Yahoo Finance, and I'm joined by Bill Gates, co-chair of the Bill and Melinda Gates Foundation. So we're 7 months in, Bill, since the pandemic really hit the United States, late October. What's your assessment of how the U.S. has handled the pandemic?
Well, sadly, as we go into the fall, the number of cases and deaths is going to go back up again. And the reason those numbers are so high is partly because our response was very poor. Our testing, our messages about masks and social distancing make us near the bottom in terms of rich countries and how bad the epidemic has been.
Do you anticipate it getting even worse in the winter weather?
Yes, the amount of time you spend indoors, the fact that people are not getting clear messages and they're tired of the restrictions, and the fact that as it's colder, your upper respiratory tract doesn't do a good job of suppressing the virus. So your that seasonal transmission level is pretty clear in the data, and so all those things are working against us as we go into the fall.
Yeah, I know you're loath to call out people personally, including President Trump, for specific behaviors, but what can we do to convince people that maybe they shouldn't hold big public gatherings with people without masks?
Well, I think the most malign thing is where you start to attack your own experts and, suggest that maybe politicians know better than disease experts. In this case, the CDC has not been allowed to really speak out. When they tried to put information on their website, that got edited by politicians. We now have a pseudo expert advising the president. Tony Fauci is a great person. His messages are quite clear, but as he gets attacked, those messages aren't able to develop the kind of patience and helping each other that would bring the death rate down.
Let me switch over and ask you about vaccines, Bill, and get your take on where things stand there. How soon do you expect a candidate to be approved?
Well, I think likely early next year, with any luck, we'll have 2 or 3 of the 6 that are in phase 3 trials right now. The Pfizer has a good chance of being amongst the first of those. They're a very experienced vaccine company and designed their study very well. But also, AstraZeneca, Johnson & Johnson, Novavax, Moderna, Sanofi. We should have choices of vaccines sometime early next year.
Do the hiccups, I guess maybe is one way to characterize it, that J&J and AstraZeneca have seen, does that concern you, or is that sort of a normal course of events?
Well, having 1 or 2 safety stops where you go in and look and see how was it related to the vaccine, that's not surprising, but these are, we need to take these things seriously. And we do have 2 of the vaccines. AstraZeneca still, the FDA trial specifically is still on a U.S. hold, and the Johnson & Johnson recently went on a U.S. hold. Now, those are very professional companies, and they'll dig into it. But if it turns out that there is a safety issue, that could knock out some of the 6. And it's amazing to have 6, but some may not be efficacious, and so. It's great we have a second wave of vaccines that our foundation has been funding that come after those first 6. And so even if the first 6, 2 or 3 get approved, their effectiveness in terms of stopping you from being sick and stopping you from transmitting may not be perfect.
And I know you've talked about the need for a global distribution plan for the vaccine. I mean, what could this look like in a best case scenario, Bill? And I guess I should ask you, what would be the worst case? I mean, how could this play out?
Well, I think the likely case, which is fairly positive, is that we have enough approvals and volume in the first half of the year that by summer, we're in a very different place than we are today. The number of deaths down quite a bit, and so that we're able in the second half to almost everywhere open schools back up. We won't be completely back to normal because we won't have got to the 70% plus of the population vaccinated by then to really drive the numbers down. And as long as this disease exists anywhere in the world, the chance of reinfection will always be there. And so we need to participate for our own self-interest, for humanitarian reasons, for strategic reasons. We need to connect up with even the poorer countries and figure out how we can make sure there's enough vaccine for them.
I mean, China recently joined the COVAX initiative, which is a group of 183 countries led by the WHO that work together on development and distribution of vaccine. The U.S. has not joined, so you would anticipate maybe it would. I mean, this sort of puts China in a driver's seat, perhaps, in a way that we're not.
No. China has a number of vaccines that at a technical level look promising, but because they haven't been submitted to a gold standard regulator, they're unlikely to be used extensively outside of China itself. Now, there's a few of those that could go through a process in Europe or the US and then would join the list of options that we have for vaccines. That's only good for the entire world. The US has shown a lot of support for funding vaccines for poor countries. The US is a generous giver to a thing called Gavi that got started back in the year 2000. And so all the US has to do is make a special allocation to Gavi to procure these vaccines. And in fact, some of the bills in Congress, a Republican bill and a Democratic bill, have had sums of money for that international response. And so we're hopeful when there is a stimulus bill, which of course that's not totally clear, but that it will include this money to buy vaccines for the poor countries. That would be in alignment with the U.S.'s past history of being very generous and playing a leadership role in global health.
The administration, Bill, has meddled really in the development and release of the FDA's vaccine approval guidelines. Can Americans trust that vaccines will be properly scrutinized before approval?
Yeah, we did have a very unfortunate incident where the FDA decided that you needed to wait 2 months after you'd enrolled over half of the trial and dosed them in order to have a large enough safety database to see if there might be side effects. And for a brief period, the White House was blocking that or saying that it was inappropriate or claiming that one of the companies had objected to it, which is just not true. Eventually, the FDA did succeed in getting that in to their guidance to the companies, and the companies all have their reputations to defend. So I think if the FDA approves a vaccine, that is the gold standard compared to the regulators, and the professional staff there, is clearly on notice that they shouldn't let politicians tell them what to do.
I want to go back to that comment you made about the stimulus bill. So in other words, international funding for vaccine distribution is tied up in the stimulus bill?
Yeah, in fact, the stimulus bill is the best opportunity to get that because it'll showcase that in order to be a good citizen and stop the disease outside the United States, that the portion of resources required to do that is less than 1% of the stimulus bill, and it'll just be amongst the various measures to help out there. I think given how distracted the country is with an election and all the problems the pandemic has brought, that no standalone bills are, getting done for anything. And so being part of that overall thing, I think that's how the people in the Congress who support these things have decided that's the most likely way for something to get done.
Interesting. Americans have become increasingly wary of vaccines, sadly. And so with this major time to be taking a vaccine next year, we hope, are you concerned about that, maybe resistance even? And is the Gates Foundation working to address that potential problem, Bill?
Well, in fact, the wave of wild stories about the vaccine, that it's, a conspiracy, and it's based on evil intent, often referring to either myself or Dr. Fauci. That is a wild new element that I wouldn't have expected. And so you do have to ask, is that going to mean things like mask wearing or willingness to take the vaccine are affected? I'm still hopeful that, there's 30% of the population who understands this is to benefit other people. And so they'll go first. And that is that experience clearly is people are seeing that there's, very, very few side effects, and that it's working well, that then we'll be able to get up to the 70% plus that we need, even if the vaccine's very effective, to block the kind of exponential growth in transmission and put it into an exponential decline. And so I think we'll get there, but it's more at risk than I expected because of that political interference and those political messages.
And a lot of those crazy stories are being shared, of course, on Facebook and YouTube and Twitter. Have you or people from your organization been in touch with those companies to try to talk to them about mitigating the spread of that misinformation?
I think those companies are doing more now to do that. This is kind of a wild phenomena, and we've always had some awareness of about vaccines, but not this idea of connecting them to a plot, like microchipping people to track them, or things that even in a fiction story, it wouldn't be all that believable. So I hope we can get the truth to be more interesting than the sort of oversimplistic explanation of what's going on with this pandemic.
Bill, many Americans are forced to wait in line at food banks or go to non-essential jobs that expose them to COVID just to get by. Is another round of stimulus important to an effective public health response?
Yeah, I think we will get a stimulus at some point. Even the Fed chief, who's it's supposed to be a pretty non-political job, is really, and he's an economic expert, is saying that a stimulus is quite important. And of course, you're seeing the job losses as the industries that had some support, like the airlines, are now losing that support. And so the layoffs, including what state and local governments are going to have to do because they have less revenue. So they're going to have to cut their payrolls quite a bit. And you start to get, if you're not careful, into a negative cycle of the economy shrinking. So although it's, ultra confused, like most things with some of the current politicians, I'm hopeful, and in this case, the sooner the better, that we do get some type of stimulus out.
Obviously, coronavirus is a key issue in the 2020 presidential election. I know you don't like to wade into politics that much, but the two candidates have very different visions with big implications in terms of how to fight to contain the virus. I wonder if you have any thoughts on either plan and then just generally about how COVID is affecting the election.
Well, one thing that everybody may not be aware of is how fantastic the CDC has been historically. They're the best in the world. They train themselves in terms of how to communicate, including getting bad news out and getting people to take measures that protect themselves. And they've been muzzled. You don't hear from them, and they're top epidemiologists. So, if you want to hear what a politician who wants things to go well and people to, praise that politician, okay, that's one approach. Or if you want to hear from people who understand diseases and disease models, that's another approach. And, that there are many, many issues in this campaign, but one is a bit about, do the experts get to be the ones who are helping to set the policy, or are the experts attacked when they try and share the truth about the tough situation we still find ourselves in?
Obviously, the focus of the Bill and Melinda Gates Foundation is public health writ large, but have you considered weighing in or advising in terms of election policy, simply because it means so many people congregating?
We're doing a lot on the tools and making sure they get done quickly, making sure that even within the country, they'll be distributed on an equitable basis as opposed to who can pay the most. We still have a terrible flaw in our testing system that the government is paying for tests where you don't get the results back within 24 hours. And it's such a waste of money, and it's helping to drive lots of infection because you don't hear your result until well after you've infected other people. And as somebody who works on disease, I keep waiting for sanity. They should run the headline every day: U.S. testing system worst in the world, delayed results being paid for.
I remember early on, Bill, I think maybe it was April, you said that you didn't think things were going to get back to completely normal until the fall of 2021. And it's looking pretty prescient right now. So where do you think we'll be a year from now, October 2021? Are you still sticking with that?
Yeah, well, the slowness on the global response means that fall 2021 won't be completely back to normal. Our goal for that should be that a lot of the service jobs can be back in place, and certainly school can be back in place. But we'll have risk of it coming back into the country during that time period. I hope that there's a small chance that the great new tools, the monoclonal antibodies and the vaccines, won't show good results. The probability of that is very, very low, but it's not zero. So, we're all awaiting the effectiveness data from the 6 trials, and it's very appropriate. We have, many different approaches that at least the phase 1 and phase 2 data did look very good. I think things will be a lot different, closer to normal than to what they are today.
And finally, Bill, your father passed away recently, and our condolences to you for that, and your family. And I don't know if you remember, but in 2009, I visited with you and him in Paris, and interviewed both of you for a cover story in Fortune magazine. So that was a lot of fun. And I know your dad was critical in terms of the creation and the mission of the foundation. What was his role in the creation and the mission, and what was his influence on you?
Yeah, he played a critical role in many respects. One is his example, is his book he wrote called Showing Up for Life, that talked a lot about volunteering, civic duty, So even I was growing up, my parents were involved in every, Planned Parenthood, United Way, Municipal League, you name it, and felt that was important. They talked a lot about philanthropy and giving, but even more concretely, when I endowed the foundation with the first 20 billion, I was still full time at Microsoft, and so it was my dad and Patty Stonecipher, a great Microsoft executive that Melinda and I knew and trusted. It was the two of them in partnership that created the foundation and got it going, and did a great job, so that as I got more time free and eventually moved over to the foundation full time in 2008, a lot had been accomplished there. And the whole tone, the modesty, the integrity that my dad had this very positive influence that endures to this day.
Bill Gates, thank you very much for your time. Thank you for your work, and best of luck to you.
Thank you.